prostate. Everybody say prostate. What is prostate? Sister, do you have prostate? Sister says she doesn't have prostate. Sister, do you have prostate? You don't have prostate. Sister, do you have prostate? Do you have prostate? You know what I'm asking? Sometimes there was one video I saw of a man. They were asking him if he has a fallopian tube. They say, do you have fallopian tube?
Please, don't offend me. I want to know what is prostate.
Okay. They say, do you have fallopian tube? The guy say, fallopian tube. He started talking about. So do you know what I'm saying is that prostate is only for men. Only men have what? Prostate. Now that prostate is something that is like a walnut. How many of us have seen walnut? Of course, we know walnut. That is how the prostate is. Now, where is the prostate? You see, it would have been better if we had a projector who see all these things clearly. Now, you see the male penis, right? The male penis is used to, two things come out of the male penis, right? Urine and semen. Are we? Urine and semen. These are the two things. So now, where is this urine coming from? The urine is coming from the bladder. Okay? Now, this urine comes from the kidney down through a tube to the bladder. And you notice our penis is connected to the bladder, right? Okay. Just at the point where the penis is connected to the bladder, that is where the prostate is. The prostate is underneath. Okay? Now, the tube through which urine comes out of our penis, there's a tube inside the penis through which the urine comes out. It is also through that tube the sperm comes out. Now, that tube is a long tube. It has a starting point and it has an ending point. The ending point is around the hole through which where the penis is, right? The hole of the penis, that is the ending point. So at the starting point of that tube, around that point, that is where the prostate is. And the prostate is under the tube. So the tube, if the tube is like this, this is the starting point. Okay, if the tube is like this is the starting point, this is the ending point, this is the opening where urine or sperm comes out from. Okay? And the bladder is on top like this, connecting the urethra. Now, connecting the penis. So the urethra, the tube is inside the penis. Let's say this is the penis. The tube is inside and runs from here to the end. Okay? So at the starting point of the tube, that is where the prostate is, like this. So the prostate is just like that. Is it clear? Now, that prostate is a small gland. It's not too small. It weighs 20 grams. About 20 grams. How many of us know weight here? Do you have an idea what 20 grams is? Okay, find out. And its length is about 3 centimeters or thereabout. That is the normal size of the prostate gland. Now, what is the use of the prostate gland? What is the use? You know this thing we used to call sperm, right? That is not the correct name. The correct name is what? Semen. Okay? Now, What is the sperm inside? The sperm are small things. Okay, fine. How many of us don't see tadpole? Tadpole. That is frog, the very small one. How you be? Tell me how you be.
Very, very small, like fish-like.
Like fish-like. Good. So it has a small head, right? And tail. That is how the sperm is like. Okay? That is how the sperm is like. Now, this sperm is produced down in the testes. Okay? And at every point where ejaculation is going to happen, ejaculation is what people call release. I mean, release of sperm. I'm using ejaculation. At every point where ejaculation is about to happen, all these sperm, they move in a vehicle. That vehicle is the liquid that you see. Okay? So when sperm comes out, it comes out like a liquid that is like pap, akamo, right? Or milk, right? Now, the liquid part of it is contributed to that semen by the prostate. Oh, somebody's confused. Eh? Nobody's confused. We are together. Oh, thank God. So, that is what the prostate adds to the sperm. So, when the sperm is moving out, when it gets to the point where the prostate is, this prostate will release that water into it. Now, why does it release the water into it? It's to protect the sperm cells. Now, for every ejaculation that a man releases, there are millions of sperm cells inside that ejaculation. So to protect that sperm cells, because that sperm is going to be deposited into the vagina of the woman, right? And the vagina of the woman, that area is acidic. It's moderately acidic. So to protect the sperm so that when it is delivered, the acid nature of the woman's vagina does not. You know why God prepared the woman's vagina to be acidic? You know why? So that it can be protected. So that it can be protected. So that things don't just enter anyhow. Okay? So that moderate acidic medium of the vagina is to protect the vagina. So when the sperm, the semen enters, to protect that sperm from the acidic medium, to protect the sperm from the acidic medium in the vagina, that fluid or water that the prostate produces, which is called seminal fluid, is what protects it. Because that is a little bit alkaline. So when it enters into the woman's body, it protects it from the acid medium. The sperms are released. They go and find the egg inside. And by that time, once the prostate has finished its work. I don't know, I'm confusing somebody. The thing is confusing. If we had a projector, it would have been better.
Okay. Again, what then is what the one they call prostate cancer at its.
Thank you, sir. I'm coming there. So that is what the prostate does. Is that a good work? It's a good work. Or you clap for your prostate. Women, clap for your husband prostate. They don't want clap. They don't want clap. So we thank God for the prostate. The prostate is doing a very vital job. Okay? Now, another thing it does is that when the semen is released, it also contracts to help the semen to move freely. Do you understand? So that is what the prostate does. Eh? You see this prostate, every child, when a child is born, a male child, he has it. The prostate continues to grow, just as the human being is growing. Now, around the 20s, when somebody gets to his 20s, the prostate reaches a stage of growth. After that point, it starts to grow again. Are we together? But when it is growing normally, it's not wired to cause a problem. Okay? It should just grow and cause no problem. As it's growing, it's doing its work. Okay? But sometimes it may grow and become a problem. That is why we are talking about prostate. So, 3 problems. A man can have a healthy prostate. Until he dies, he has no prostate problem. But people will have prostate problems. Now, prostate problems begins usually from 50 years of age. So anybody who has gotten to 50 years should start watching his prostate. Should start doing surveillance for his prostate. Are we together? Now they say if you bring 100 men that have become 70 years old, 75 of those 100 men will have enlarged prostate. 75 or out of 100 men that are 70 years old, we have enlarged prostate. Now, depending on where this enlargement is coming from in the prostate, it can cause problem or it may not cause problem. Are we together? 3 things can happen to the prostate. Number 1, if there's an infection in the prostate called prostatitis. The second one is what we call prostate enlargement, BPH, benign prostatic hyperplasia or hypertrophy. Some people prefer to use benign prostate enlargement. Now, why do they call it benign? Because even though the prostate is enlarged, it is not a cancer. Are we together? Even though the prostate is enlarged, it is not what? A cancer. That is why it's called benign prostate enlargement or benign prostate hypertrophy or hyperplasia as they will use. We'll use enlargement in this place. Then the 3rd thing that can happen to the prostate is prostatic cancer. Prostatic what? Cancer. So that is why we are here. All of these 3 things to see how we can prevent them. Because provided you are a man, for the fact that you are a man, your prostate must grow. So you cannot bind and cast it. It must do what? Grow. Because if you are growing, your prostate will what? Grow. Now, how does it grow? You know, we have hormones, men. The predominant hormone that we express is testosterone, right? Testosterone, right? Good. Now, dihydrotestosterone is a form of testosterone. The more we express this hormone, the more our prostate gland is increasing.
Are we together?
Now, prostatitis, infection or inflammation of the prostate, can be as a result of urinary tract infection. People who have diabetes, people whose immune system is not very strong, they can have inflammation of the prostate. So they may be treating other things, but all that they have is just inflammation of the prostate. That one is not so bad, because if you treat with antibiotics, it will be taken care of. Okay? Are we together? All right. So let's go mainly to these two other issues. Okay? Benign prostate hyperplasia, or sorry, prostate enlargement and prostate cancer. Okay? Now, how will one know when one is having prostate enlargement? Now, we said this is where the prostate is, right? And at this point is where the tube is that through which urine passes, right? Okay. If the prostate now becomes big, what do you think will happen? I think we should just close and go now. They have already said it. It will block the passage of what? Urine. So now, what will it cause? That blockage can cause two categories of symptoms to a man or in a man. It can cause either the irritative symptoms or the obstructive symptoms. When we talk about irritative symptoms, it means that the enlargement have not started obstructing the tube, but because it's enlarged and it's affecting the tube in one way, it's leading to some form of irritation. And that is where you will see a man will wake up more than 2 times, 3 times, 4 times, and go and be weak in the night. Are we together? Because that urethra is irritated. That is when you will see somebody, he has gone to even during the day, he come back. Before you know, he say, when you go again, at the go toilet. He come back. When you go at the go toilet, frequency is frequenting toilet to pass urine. That's called frequency. It's one of the irritative symptoms. Then the other one is when person not feel hold urine. Once urine come like this, he must get to the toilet in the next 3 seconds. Otherwise, the thing will drop. Urgency. Are we together? So these are the irritative symptoms. At this point, even though the prostate is enlarged, it is not yet so bad. Until when it gets to the obstructive symptoms. Are we together? Until when it gets to the what? Obstructive symptoms. So that obstructive symptom, it don't big well now. It don't block the tube. Sometimes it can block the tube to the point that the person will not even be able to pass urine. Have you ever heard that before? That somebody was not able to pass urine. They had to take the person to the hospital and put a hole on the bladder for the urine to come out. Because even at that time, if you pass a tube through the urethra, it will not even come out. But before it gets to that point, the obstruction starts very small. Now, what will happen? What will the person see? First of all, he will go to the toilet. He won't piss. He will have to wait for some time before the piss will come out. That's hesitancy. He's hesitating. The urine is hesitating. Should I come out? Make I come out. Make I not come out. The person will be Sometimes he has to be pushing. He has to be pushing. He will stay there before the thing will come out. Are we together? Then sometimes when it comes out, it doesn't come out freely. It will be coming out in drops. Sometimes it can come out freely. It will be flowing small, weak stream. And sometimes it can even be flowing. After some time, it will stop. It will flow again. It will stop. It will flow again. It will stop. Sometimes the person has finished passing urine. He feels that he has finished passing urine. But by the time he returns back, he feels that there's still urine there. Or he passes urine. By the time he has put his pee back into the pant, you will see urine is still dropping. That is terminal dribbling. So these are the things that a man will see that will make him think that, oh, there must be a problem with my prostate. Now, if you look at all these symptoms, they have other things that can happen in a man that will have these symptoms, right? For those ones, when we say irritative symptoms, if somebody has a urinary tract infection, it can have those symptoms. Then, if somebody has diabetes, it can have some of these symptoms, right? It can have urine problems, right? So if a man doesn't have diabetes, he doesn't have urinary tract infection, no fever, no chills, but is just simply experiencing these urine problems, he has to go and check for prostate disorder. It may be a prostate problem. Are we together? Are we together? So these are the way prostate disorders can manifest. Now, this enlargement is different from cancer. It's not the same thing as cancer. Cancer happens when some of the cells in the prostate now change their lifestyle. They change their lifestyle. They say, we don't want to be normal again. Let us become abnormal. So by the time they become abnormal, that is when prostate cancer will set in. Are we together? And prostate cancer can present with a lot of things. Even for prostate cancer, you see some persons will be passing blood in urine. Apart from all these urinary problems, if the cancer has gone far, you will see the person is growing, is losing weight. Sometimes back pain. And this person may not be able to eat food anymore. He will be losing appetite. These are some of the things that are used to differentiate prostate enlargement from prostate cancer. Am I confusing us? Now, what can cause these prostate problems? What can cause these prostate problems? These prostate problems, although, I saw one video somebody sent to me that a man was saying that if somebody does not ejaculate many times, he will have prostate problems. How many of us saw that video? Oh, you saw the video? And that is why people should marry many wives, Jabi, and start having sexual intercourse all the time. There are a lot of wrong information on the internet. And that is why we have to be careful what we see and read and swallow on the internet. Now, science have not really been able to find out what exactly is the cause of some of these problems. But there are certain factors that they have said will be present in a man that will make that person susceptible to have these conditions. Are we together? Now, for prostate enlargement, what are those things that can cause prostate enlargement? What are those things? You know, there are some of those things that have been linked to prostate enlargement. And one of them is the kind of diet that we eat. A diet that is very high in fat. Somebody say fat. Hope you know milk has very high fat, right? Diet that is very high in fat can be a cause of somebody who is taking that diet can develop BPH. Are we together? Then also, somebody who is obese, people who don't engage in exercise. You know, we have said that for hypertension, right? So you are seeing that all of these things are connected in one way or the other, right? So people who don't engage in exercise, they have a tendency to develop BPH. Are we together? We are together, right? We have talked about fat, right? We have talked about physical activity. To overweight people, they can develop BPH. Now, for BPH, the major cause that we know is that as a man ages, just like we said, right? And exposure to testosterone, then other things, because not every man develops BPH, right? But other things that can now cause a man to have BPH are the ones that we have spoken about. High-fat diet, a diet that is not rich in fruits and vegetables. There's something we call a diet that is not rich in selenium. So these people who engage in these things can develop BPH. Then people have high level of testosterone or who are taking drugs that give them or supplements that drugs that supplement their testosterone levels. They can have BPH. Are we together? That is prostate enlargement. Now, what do we do? How do we avoid prostate enlargement? How do we avoid it? By living a healthy lifestyle, right? By doing what? Living a healthy lifestyle. Physical activity. Foods that are rich in vegetables and fruits. Then, by avoiding weight gain, obesity. Then some people will still do all this and still have BPH. What do we do? Now, what is your own role to play? Your own role to play is this. You know, it has also been found that people who are of our Black Africans, we also have that tendency to develop prostate enlargement. So what do? We have to go for regular prostate checks. So the moment you get to 40 years of age, as a Black man, you have to begin to check your prostate. Now, how do you check your prostate? You just simply go to the hospital and tell the doctor, I need to have my prostate checked. And what will they do? They will do a rectal examination for you. What the doctor does is to put on a glove in his hands and then with a finger, put a finger into the man's anus. Because from the anus, you can feel the prostate. You know, we say the prostate, we already said where the prostate is. It's in front of the rectum. So when the doctor puts his finger into the anus, he can then feel the prostate. By mere feeling the prostate, he can know whether this prostate is enlarged or is normal. Are we together? Now, if the prostate is enlarged, what next do we do? The next thing to do is to find out how this enlarged prostate is affecting the life of the man. Many times we'll tell the patient, depending on how enlarged it is, and there's something called an international prostate or prostatic symptom score index. What is a form that contains many questions? The doctor will ask you those questions. The idea of asking those questions is to find out how this condition is affecting your quality of life. If it is affecting your quality of life, its affectation of your quality of life is severe, what the doctor will do is to start treatment. And what are the things that we use to do treatment? First of all, we can give some drugs, okay? There are some drugs that we give that reduces the size of the prostate. These are not herbal drugs, so we are not talking of herbal drugs. It is not indicated or it is not recommended that you should go and start taking herbal medication for prostates. There are drugs that can reduce the size. There are also drugs that can reduce that can relax the prostate. Because you know, when the prostate is relaxed, it will a bit relieve the urethra, right? So that urine can pass. Okay? So the ones that reduce the size of the prostate are the ones that stop testosterone or reduce the release of testosterone, that hormone. So when it reduces the release of testosterone, the size of the prostate begins to do what? Reduce. Are we together? Yeah. So these drugs can be given. Now, if these drugs, some people stay on these drugs for a long time. Now, if these drugs eventually, maybe they have worked for some time and they are no longer working, and maybe there's nothing we can do again, you go for what? Surgery. Somebody say surgery. And these surgeries, although they have their own complications, everything in life has complications, right? If they are handled properly, these surgeries can relieve your symptoms. Are we together? But we are here to emphasize prevention, right? We are here to do what? Emphasize prevention. And the only way to emphasize prevention is to do what? Is to live a healthy lifestyle. Even alcohol. Somebody say, I'm marrying alcohol. I'm telling you the truth. I'm telling you the truth. So, diets rich in fruit, we have said all of that. reduce weight gain, engage in physical exercise. And then, once you enter 40, be health conscious. What does it take for you to go and say, oh, doctor, check my prostate? Doesn't take anything. He will go and check it. If it's not enlarged, we'll give you another appointment. Okay, you are not enlarged, you are free now. Continue living your life well, but let's see you again next year for another check. Okay? Now, even with that rectal exam, we can also find out if that prostate is just enlarged or is a cancer. Because the way it feels when it's just enlarged is different from the way it feels when it's a what? Cancer. Are we together? Yeah. So we are not saying we should wait until you are running to the toilet to wee all the time before you go and check. No. Check before it happens. Okay? So that when you check before it happens, whatever it is you are doing that you can change, okay? You can change it. Are we together? Amen. So, that is that for prostate, right? Enlargement, prostate enlargement. Now, one of the complications of prostate enlargement is when the prostate is enlarged, urine cannot come out the way it is coming out. That urine will continue to accumulate. Are you hearing me? It will fill the bladder. Are you hearing me? It will begin to ascend. It will ascend into the tube that connects the kidney to the bladder. And it continues to ascend. And this urine begins to pool until when it pools into the kidney. And it can lead to something called hydronephrosis, which is too much water in the kidney. And this can also cause kidney problems. So that is why it's important to relieve the obstruction so that urine can flow normally. Are we together? Are we together? Yes, sir. Then for prostate cancer, what are the causes? If somebody papa get them, this not be ancestral cause. If somebody papa get them, the person need to be careful. Are you hearing me? And to be checking yourself regularly. If you know any of your parents suffered from prostate cancer or died from it, you need to check yourself. Are you hearing me? Eh? And some people have said that red meat. Somebody say red meat. How many of us they chop suya? Wait. You chop suya. You need to repent. Red meat has also been implicated. Are you hearing me? When we are talking of diet, in addition to fat diet, high fat diet, red meat have also been what? Implicated. I usually advise my patients that once you are growing old, try and do more fish rather than what? Meat. Try and do more fish rather than what? Meat. Fish is more helpful. It has more omega-3 than meat. Are we together? So, we are now on prostate cancer, right? Talking about the causes. Is it not? Is somebody confused? Smoking. You know, we say we will not emphasize smoking here because nobody is smoking here. Abi? So, okay, let us assume. Assumption is allowed for now. If anybody is smoking, by the time you are leaving here, you go and sin no more. All right. Then, we already talked about obesity, right? We already talked about hormones. Abi? if you are on drugs that help to that increase your hormone levels, right? Then we talk about exposure to certain chemicals. How many of us here do battery work? I don't know. If you do battery work, you make paints, you work in all those industries, you need to try as much as possible to take your precautionary measures, right? While you are working. There's a chemical called cadmium. Those who are exposed to it, have the risk to develop prostate cancer. So how do we avoid it? You already know. Sister, how do we avoid it? You tell your husband. Tell me one way. Tell your husband. How to avoid them? You don't know. Sister, tell us. You don't know. Sister, tell us. Yes, prostate cancer. Give your husband food when they rich in fruit and vegetables. Give your husband food when they rich in fruit and vegetables. All this plenty oil, stop them for your husband. Fry no good. No red meat. No smoking. No. Oh, I beg, clap for her. Clap for sister. More clap for her. She has already itemized everything. Exercise. Very important. Physical exercise. So these are some of the ways to avoid it. Then sometimes, tell your husband, my dear, you don't go check your prostate. You don't go check your prostate. If you do them January, February, March, April, May, June, July, August. After August, wait till they see again. They don't know. September, after September, October, you no go. November, you no go. December, you must go. So you must take him to the hospital to go and check his prostate. Apart from the digital rectal examination they do for prostate cancer, there's another thing you can do which is called prostate-specific antigen, PSA. So when you go and see your doctor and say, I want to check my prostate, apart from that thing he will do, he also send you to do a test. And that test, when that test comes out, depending on the level of that test, for prostate cancer, that test, the elevation is very high. It goes the increment in that PSA is high. Normally, it's supposed to be between 0 and 4. But for people who have prostate problems, especially prostate cancer, it goes up. But there are some other things that can happen in a man that can make it to go up. Okay? And that is why we don't just treat investigations alone, test results. We also look at the patient and also treat holistically. Are you hearing me? Are we together? All right. So that is that for prostate cancer. Now, the good thing about prostate cancer is that if it is caught early, it can be treated. But if it has become late, forget it, unless a miracle happens. There are different stages. It can be stage 1, it can be stage 2, it can be stage 3, it can be stage 4. Once it's stage 4, Okpari. What's Okpari? Which people they say Okpari? Is it Yoruba? Na Yoruba? Okay. Okpari. Okpari. So we will not get there in Jesus' name. But when it's in stage 1, you can do something about it, okay? Stage 2, we can still keep doing something about it. But once you get to stage 3, and you know that the thing is here. So once he wants to spread everywhere, and from there, it goes into the blood, and then that is over. So that is that. about prostate cancer and prostate diseases. I want to stop here. Brother has a question. Amen. Yes. Yeah. Yes. You say? Yes. To some extent, it is. There is the genetic aspect to it. Yes, there's genetic aspect to it. Yes. That's our leader.
Have you got any link with intercourse with your wife? Maybe regular or irregular on either regular or on irregular. Have we got to do? Have we got anything to do with intercourse, regular intercourse or not?
Okay, brother. Thank you very much for your question. Earlier I had addressed this matter, right? If you are married, it's good to have regular intercourse with your wife, right? If you are married, it's good to have regular intercourse with your husband, right? I'm begging married people, please find time to have regular intercourse. Very important. So, whether, yes, it has been advocated, are you hearing me, that lack of sexual, reduced sexual activity can result in prostate enlargement, prostate cancer, but it is not scientifically established. You know why I say so? Why it is not scientifically established is because most of the patients we are seeing, they are not priests. I'll be our priest doing. So I don't do it because only God know. Okay, because we don't really see them coming down with that prostate problem. Okay, and it has not been scientifically established. And because it has not been scientifically established, I cannot come and tell you that that is a cause of it. Are you hearing me? But married couples try to have sexual intercourse regularly. Yes. Sorry, you have time.
CMO.
How many people have questions regarding the another person will ask questions to give room to another person. Let us know how many people have
Calm down. Calm down. Let them ask. Don't worry. I'm listening to you, sir.
Okay, sir. When you were talking, you talked about regular urination. I want to find urination.
Yes.
So I want to find out, in the event when the weather is cold, you urinate often, and as it changes, maybe you don't urinate as such. Is it akin to prostrate, sir?
Okay, yes.
Let me just quickly add to that. Like in the daytime, I'll use myself as an example. I don't normally pass out urine much in the daytime.
Yeah.
But at night, I do. Add to the question the man just asked. What is the cause of that?
Okay. Thank you for that. Let me answer this one. Sorry. Thank you. So, brother, when you come to us, we'll ask you certain questions. You say, I'm urinating frequently. We'll ask you, do you drink water a lot? If you don't drink water a lot in the night, you have no business urinating frequently, right? Are you on certain drugs? If you are not on certain drugs, you have no business. Right? Does this happen to you only when it's cold, when you sleep in under AC or when the environment is cold? If it's because the environment is cold, you have no business with prostate cancer, okay? Because when the environment is cold, because of vasoconstriction, you understand, and all the physiological mechanisms that take place in the body, there's tendency for one to go and urinate often in a cold environment, okay? So the diagnosis of this condition is excluding all these other concerns, okay? There are some persons who are on certain antihypertensive or hypertensive medication that make them to pass urine often. So if you are on that medication and you take it in the night and you are going to pass urine often, that is not the case. But the thing is that whether you are passing urine often or you are not passing urine often, the moment you get to 40, because you are an African man, try to keep an eye on your prostate. Does that answer the questions? Thank you. Sister, I wanted to ask one question there. We'll take how many questions now? How many are we going to take finally?
Like 6.
We'll take 6 more.
You passed out stone. So my question is it possible for somebody to be urinating and urinate out stone? So when I asked that guy, he said that they said he has stone in his bladder. Is it possible, sir?
Although that does not relate to prostate, right? Yes. There are things that are called, there is something called kidney stones, bladder stones, right? How do they develop? You know, and that's why I was talking about drinking lots of water. Now, who is going to shack this one now? Who is shacking this one? Okay, so this man. Okay, when he shack this one finish. Oh boy, Mona, they avoid this thing, no? Eh? When he shack this thing finish, he no go drink water. Because this one don't fully belly, abi, and probably has quenched his thirst. He will not drink water. Some of these things, they have high calcium contents. They have high uric content. So things that can crystallize and cause stone in the body, some of these things have them. So when you don't drink water very well, there are some kind of stones, oxalate stones, urate stones, calcium stones. These are when your kidney is filtering the blood. It can, because of the fact that you are not taking enough or you are taking too much of these things, they can precipitate and result in stones. Those stones can be in the kidney, they can be in the tube that connects the kidney to the bladder, or they can be in the bladder. Now, the treatment for some of those things may be surgery. But when some people come, some people may not even know that they have stone. Maybe they just come, we do an ultrasound scan for them and they will see stone. So because it's not causing them problems, we may tell them, okay, go, there's stone in your kidney, there's stone in your bladder, go. Drink plenty water, do exercise. If you do this, the stone will dislodge and will pass out in urine. So that is where you see some people passing stone in urine. But when they now have those stones and they cannot pass it in urine, they have to go through another procedure through which that stone will be broken down and then expelled. Does that answer your question, sister? Thank you. Somebody there.
Yes. My own is a kind of a testimony. And but I want to point out one thing. When you mentioned of a priest, why priests are not having this issue? You know, they say God is a great physician. To my own belief, I know that God has ordained them, assigned them for such a work. So He has worked out that way for them not to have that problem. So I believe that having sexual intercourse with your wife at least will solve that problem. Then coming to the urinary tract stone, I'm a victim of a urinary tract stone. I normally have a pain here. When I went to visit the doctor, the specialist already assigned me for surgery, but he now advised me to be taking much water. And I tell you, a day I will take almost 4 liters of water, and that solved the problem. Till today, I don't experience such again. So that is it.
Thank you very much. Let's clap for Jesus. So, brother, thank you for that information. I mean, the first part of your deposition, I never ever thought it like that. It's actually true. God may have ordained them for that assignment and separated them from that condition based on grace. All right, thank you for that. I will thank God for helping you with the kidney stones. Sister wanted to ask.
Okay. Glory to Jesus.
Honor to Mary and Joseph.
My own is just like a question, and I will still contribute to something. There was, as you talk about prostate cancer for the men, is it possible, as you were told even before today, that women have cancer of the womb? Is it possible, sir? I want to know. Yes, sir. And secondly, as they say women have cancer of the womb, most of us, we have taken that opportunity of hearing about this issue, and we go to our various hospitals to find out if really I have something like that or not. But at the end, I think we went with almost 6 women here in Mpape. After them, they find out that there is nothing as such in our womb. Thank you, sir.
Thank you, sister. Well done. I appreciate you for taking effort to look out for the health of the women. Yes. It's just that that doesn't fall within my purview concerning what I was giving. But I will address it. Yes, it's possible for women to have cancer of the womb, right? Yeah, it's very, very possible. And women, they have their own checks that they should be doing. So maybe one of these days, people can invite somebody to talk to you on that. Because there are certain things you need to do. Especially our married women who are sexually active. At a particular age, there are certain screenings you should engage. And those screenings, I think they end usually at 70 or 75, where they do the last screening. So that screening is supposed to be a regular check, so that that thing doesn't come out. Just the way we have talked about rectal examination, PSA for men, there are also other screenings and also some vaccinations that women take that help to prevent them from having not only cancer of the womb, even cancer of various parts of the vagina, the cervix, and all of that. Thank you, sister.
We have one person, only this one.
Okay, thank you.
This is number 6. End of discussion.
Good afternoon, all.
Thank you.
My question is about prostate enlargement and prostate cancer. Regrettably, we just buried somebody 2 weeks ago. It's an elderly man who had a private doctor assigned to take care of him because he was under stroke. And then at the end of the
under
stroke, he was having stroke.
Okay.
At the end of the day, he was diagnosed to have prostate cancer. And then the children were like, how managed when we are here? Then the doctor was saying he'll always take his enlargement. Understand? So the confusion is now, can somebody get cancer without prostate enlargement or vice versa? Can you have enlargement and not go down with cancer, or get cancer without developing prostate enlargement?
Yeah, thank you, bro. Thank you for that. And you see, that's why I try to take the two topics differently. Somebody can have enlargement of prostate and will never develop cancer. Is that okay? why somebody can have cancer without enlargement. Yes. You see, when you do a digital rectal examination, you don't even just go to check for enlargement alone. We are also looking at the surface, how smooth the prostate is, and also some other things, some other markers, okay? And that is why you don't just do that DRE alone. You also need to do a PSA, which is a prostate-specific antigen. So that is usually what gives us a suspicion of prostate cancer, okay? So it's possible for that prostate cancer to be enlarged. It's possible for the prostate gland to have cancer without getting enlarged. And usually, what we'll now do, even though the PSA is high, the prostate is rough, you don't just immediately or directly diagnose cancer. We have to do something called a biopsy. We have to do something called what? A biopsy. It is a biopsy that gives the definitive diagnosis of prostate cancer. Every other thing just points in the direction of suspicion. So we suspect. That then leads us to do a biopsy. But if I go and check somebody's prostate, it's not rough, it's not enlarged, I do a PSA, it's normal, I will not go into and do a biopsy for that person. Is it clear? That answer your question. Prerogative of mercy. Ask your question. Sorry. Honor to Mary and Jesus. Yes. Okay. Consists of breast lump in women. Well done. Do you have prostate? You don't have prostate. Okay. So causes of breast lump, we have quite a number of causes. Sometimes I just saw a patient, I had breast lump, we did a scan. It's something called fibroadenoma. Fibroadenoma. It can be as a result of fibroadenoma, which is not a problem. All you just need to do is to remove it, okay? Then a breast lump can just be normal breast tissue, but you're just seeing it as breast lump. It can be normal breast tissue. Then if there's a traumatic injury to the breast, it can cause lump, okay? And finally, the bad guy, breast cancer. All right. Honor to Mary and Joseph. Can I have this video? Come. Can I have the video?
Yeah, no. I will come to that. We'll come to that. Okay. The first place, I really want to appreciate as many of us and make our time to be here. Someone here is fine, like I said. Even though it's not really easy, we started this program, we go to 12. The person says it's 12 o'clock. If you check now, it's 4:22. You are here, you are not itching, nobody is complaining. We thank God for all of you and these sacrifices you have made. I want to believe that you did not regret this your sacrifice. Do you regret it? Do you like thank the Lord? Clap hand for yourself. And the reason why we are not born was because God has blessed us with this our brother who has made time out of his tight schedule to come and stay with us. You can see he's not worried because he's really concerned about our well-being. So can we put our hands together for him once again? Yes, I will seek the microphone so that I was trying to call his name. I don't know this one. Maybe not this is no one production. Whether Osezua or whatever. Osezua, Chris. Will tell us his full name. And I want to beg you, brother. I would want to beg you whether to just add in for the next time in our CNL platform so that those who have questions, if they can ask some of these health-related questions and tag you, you can just send the answers to them while others benefit. We used to do that for us in the other group, move videos on some of this so that we keep updating and learning how to improve on our health. So we really appreciate you and we continue to pray that the good Lord will keep strengthening you and grow you in your profession and ministry in the mighty name of Jesus Christ. Amen. So you are most welcome, and we want to beg again that anytime it pleases God that we have program of this kind, we will not refuse if we invite you to our local parish here. God bless you, sir. So please, they say they want to know your name, your parish, even your place of assignment, current.
Glory to Jesus. Okay. My name is Brother Olumese. Olumese Jude Osezua. Actually, brothers calling me Osezua Christ. I think that's how it appears in my email. Osezua for Christ. So anytime I just want to write something, it will just show Osezua Christ. So I just carried it like that. But I'm Brother Olumese Jude Osezua. I work in a federal medical center here in Abuja, Jabi. And my parish is St. John Meridiani Catholic Church in Lugbe. And I think that is about me. Thank you.
Thank you, sir. So please, the good work you will do for him is after spending all this time standing for how many hours, lecturing us and blessing us. The only good thing you do for him is that everything that we have learned, we should go and do well, practice them. Of the truth. And this thing was going on. Part of what I wanted to do was the mineral we bought. I had wanted to cancel it, but even they bought already. And all this my fighting. So the only thing I did my own was that I put plenty of water just to drink. But I'm going to repent from today. You know, we kept saying, keep repenting. I mean, and so we need to live. So whatever we eat that is going to affect you, or reduce your age on air, or put you under some kind of health condition that will make you to keep suffering or suffering your people, I think it's better to avoid it. It's better to avoid it. So please, as you live here, go and start practicing. Do regular exercise. There are some of them they prescribe that are not really expensive. It doesn't cost anything to do exercise. Even if you don't have time to go out, some of you have big downloads. You can just stay around the place, you do some exercise in one place.
Sometimes I can stay in my parlor and I will do exercise until I will sweat and become so tired. I will time myself. And it's really helping me. Anytime I do such things, there's a way I feel because of the nature of my business. I don't have time to go out that early in the morning.
But once I come back or in the evening, I do that. And it's really helping me. So please, I want to beg all of us, all the things we have learned, if we don't practice them, it means whatever we have spent, the church has spent, paying bills or generator and all of that for us, it will amount to nothing. So please, just the only way to appreciate him and appreciate the CMO for organizing this program is to go and practice them. Our brother gave testimony of how he was advised. He followed the advice, and today is what? He's enjoying it. What would have led to operation? Today, he didn't go through that operation, and he enjoyed it. So that is the purpose we organize this program. As we keep going, if God give us opportunity, whatever we think is going to benefit us health-wise, we will equally organize this kind of program. Like we told us the other day, already the CMO is organizing how to get this health insurance program for ourselves here